Thank you for staying with us. Joining me now from the Brockville General Hospital, I'm talking with the President and CEO, Nick Vlacholias. Nick, how are you?
Good. How are you, Doreen?
Very well. Happy New Year to you, by the way.
Likewise.
Thank you. So as of January 21st, there was a COVID outbreak that happened at the hospital. Did that close down the whole hospital, or was it just a particular unit that was closed down?
The outbreak is confined to what's called a level 2 medical surgical unit, and that's the only outbreak that we have at this time.
Alrighty. So, do you have patients, like out of area patients in the hospital that have COVID?
And we don't. We actually have the majority of patients that are here are local patients.
Are local.
Yes.
Are we talking those that aren't vaccinated, or are we talking a specific, like a certain sector of the population, like maybe the older individuals, like?
Well, it's interesting because at this time we have 17 patients with COVID, and I make the distinction with COVID and not for COVID.
Yes.
For admissions. And I would say approximately half of them are not vaccinated and half of them are vaccinated, and the majority of them are over the age of 40.
Okay. Thank you for that information. So services at the hospital, what can people not access? What is not available to them? I would imagine there's some clinics that are still happening.
That's correct. So Directive number 2 came into play by the province of Ontario that essentially says we only can provide emergent and urgent services, which means that elective surgeries have been deferred until further notice, and ambulatory care visits to, as we call it, the ACU, has been deferred, but only the essential emergent and urgent services. And I'll use the example for diagnostic imaging, which includes X-ray, ultrasound, mammography, and several other types of services. It's only emergent and urgent in order to support what's happening in the organization at this time. It is unfortunate that we had to do this across the province of Ontario. And essentially, it's freed up additional resources so we can redeploy to the areas that are in high need now, given the Omicron variant has highly contagious virus.
Yes.
Variant. And so we've had to redeploy lots of staff. Currently, we have approximately 32 staff that are either off with being COVID positive or being close contacts with people that were COVID positive. And we're dealing with that same issue at the same time when we have increased demand and our staff are being impacted by COVID, given that they live in the community.
Yes, yes. How is the staff doing at BGH? I know they're coping, but how are they doing?
The staff are phenomenal. You know, to underscore, they're frustrated and they're stressed. They are members of the community like everyone else.
Yes.
So usually you have your personal life and your work life. Both sides of the equation now are being impacted. And particularly parents with young children, with schools being out, that's the added complexity. And just the added complexity of just the fatigue around everyone's suffering that fatigue around this pandemic. And the spring is coming, and I'm just hoping that the weather will cooperate and we'll be out of this wave number 5.
Yes, thank goodness. Let's hope. So the Clinic Assessment Center has opened at the memorial, and there's been a number of people that have accessed their services. Has that actually eased what has been happening in your emergency at the hospital by having the assessment center opened?
Well, definitely. The assessment center has been open since, I think, March 2020. And so it's going to be 2 years this upcoming March. And we work very closely with our family health teams, particularly the Upper Canada Family Health Team,
Mm-hmm.
who's operating it on our behalf.
Yes.
And basically it's in partnership with everyone, the city of Brockville, given the location. And essentially it has had a positive impact. And anyone with moderate type of symptoms for COVID or respiratory, we would encourage everyone to go there. Anyone with mild symptoms, certainly stay home for the duration of the 10 days as indicated by public health. But if you have moderate symptoms, you can make an appointment at the clinical assessment center. And the purpose of that is to ensure that our community remains safe.
Yes, yes. And not coming to the emergency, which people were doing early on in the pandemic. So Nick, the Brockville Shopping Center, I've noticed that the vaccination clinic that is set up there, there's lineups. There's still lineups there. That's a good thing, isn't it?
That's a very good sign. And in cooperation and partnership with the Upper Canada Family Health Team and other family health teams and public health, the hospital is involved in the vaccination clinic also. And we are doing phenomenally well across Lanark, Lees, Grenville. And I'm just going to use the stat. We are still the best in the province for fully vaccinated over the age of 5. Although there's other health units that are catching up to us, which is a really good thing. Mm-hmm. The more people that get vaccinated, the more that we're protected. The booster shot doesn't prevent always an infection of the variant, but it does prevent serious harm and or hospitalization. So we encourage people to get the booster and to get fully vaccinated. It works.
It does make a difference to have that, doesn't it? Do you still allow visiting the patients at the hospital?
For general visitors, the answer is no. And we stopped that right before Christmas.
Mm-hmm.
We do have what's called an essential care partner process, whereas if you're here longer than a certain time frame, you're allowed to register as an essential care partner, and you're part of the care team. And we have a very, very rigorous process to ensure everyone remains safe, including the essential care partner, our patients, and our staff.
Oh, wonderful. Anything else you'd like to share with us, Nick, as to what is happening at the hospital and what our viewers should know?
Well, I think, the COVID outbreak for itself here at the hospital, it's our first one. We've worked really hard to keep the virus outside of our doors. It's unfortunate, but our staff are very dedicated, and we'll get through this, and hopefully we don't have another outbreak. And I think the last item I'd like to say is thank you to the staff. Thank you to the community for our support. It's been a tremendous, tumultuous, 20 months, 30 months, 24 months. It's been tough. We'll get through it. And I think as Ontarians and as Canadians, we have to decide what kind of healthcare system we want post-pandemic. Mm-hmm. We've seen that there are certain areas that we have to make significant investments in, given that we don't have the capacity that other countries have. So I think we have to rebuild and take the best parts of our healthcare system and rebuild it and look to the future.